Good morning, everyone. I'm Seba Aljomaa. I'm a PhD student working under supervision of Dr. Miklos Garami, and I'm happy today to share with you my thesis or my work during PhD, starting with the title of my thesis, Novel Digital Health Approaches in Oncology. Actually, I'm basically a pharmacist, and with two projects, we are looking forward to improve the healthcare through the inspiring digital health technology. And starting with the first project, comparing the effect of digital health interventions on the quality of life of the individuals facing cancer by conducting a systematic review and meta-analysis, I would highlight the impact of cancer on a patient's quality of life. Especially with these numbers, these percentages, how the patients are suffering because of the cancer itself and the treatment adverse events as well. Unfortunately, till now, the current standards of care are not enough to minimize the suffering of the patients. Plus, we started to think out of the box, looking at the adoption of technology widespread, especially during the COVID pandemic, where the digital health interventions accelerated. Even WHO started to publish recommendations in this regard. So digital health interventions are expected to improve the quality of life. So we aim to investigate the efficacy of these interventions in oncological care. By asking this clinical question, does the e-health means electronic health and m-health, mobile health, the two main categories of digital health interventions, it changed the mental and physical health outcomes of cancer patients during their therapy as our population? We compared different types of digital health interventions with the standard of care, and also the outcomes were broad as well, like different mental and physical health outcomes. The hypothesis was the digital health interventions will improve the mental and physical health outcomes of cancer patients, and especially the ones measured by standardized scales. We conducted the systematic search with a search key of 3 domains, the cancer, the intervention, and the outcome ones, and we started with about 25,000 of articles to end up with about 200 of eligible articles. And regarding our outcomes, actually we use the standardized mean difference, which I will talk about, and about the analysis which is done now. Actually, according to the available data, we categorized the interventions into games, virtual reality, mobile applications, and web-based interventions. And regarding the outcomes, quality of life, and anxiety, fatigue, and depression, that are the main findings where we got enough data to analyze. And today I will present most of these main findings through the forest plots, starting with the quality of life. And since we compared the change of quality of life between the mobile applications as interventions and the standard of care, actually we see that this result is statistically significant, showing or favoring the effect of the mobile interventions to improve the quality of life of patients over the standard of care. Actually, also I would highlight of using the standardized mean difference because the heterogeneity of the methodology in these studies using like different frameworks and also different scales, so standardized mean difference is the best in this case. And regarding the change in quality of life by using gaming, also the result favored the games, but the result is not significant, and also we had just 3 studies in this regard. About the web-based interventions and the effect of them on changing the quality of life comparing to the standard of care, the result is not significant, and we have like different, I would say, directions in the individual studies, but also the Hwang study showed a very good improvement when the results, or sorry, when the framework was with very specific criteria to choose a specific patient. And talking about anxiety, and especially the effect of the virtual reality in different types of treatment, like starting with chemotherapy, radiotherapy, and painful procedures, that the virtual reality, even with non-statistical significant results, showed a trend to improve or to minimize the anxiety of the cancer patients comparing to standard of care. And regarding the mobile applications, also we got the same, like, At some point, the results were favoring the intervention, but it's not enough data and not significant. And talking about fatigue, actually, the web-based interventions will represent the effect on fatigue as interventions comparing to the standard of care in these studies. Actually, the result here is positive because the scales are scored in reverse way, so positive number 0.62 is not significant, but it means like better result, better quality of life, and less fatigue. And regarding the last first plot I will present today for depression, also the effect of web-based interventions to change the depression comparing to the standard of care. Actually, the result here is not significant, but showing also a trend to minimize the depression by using the web-based interventions comparing to the standard of care. Our project now is done. We submitted the manuscript, and talking about the strength, I would say we had many RCTs in the analyzed data, and also having different measurement tools is an advantage. But unfortunately, using interviews and semi-interviews in many regards, and also difficulties in comparison because of the heterogeneity of the frameworks, not having enough sample size or small sample size were our limitations. And to conclude this, I would say that digital health interventions improve cancer patients' quality of life, and especially the virtual reality has the potential to reduce the anxiety among them. But we are looking for more implications on the level of practice by age-specific digital health interventions, and also and especially for on the level of the research, that we need RCTs with high patient numbers, also more homogeneous populations to give like stronger conclusion, and also disease-oriented or targeted, and also age-targeted digital health interventions to have. The manuscript is submitted to JAMA Oncology journal. And now I will start talking about my second project in the same line, but more specific, which is the virtual reality, investigating the distracting effect of tablets, virtual reality, and analgesic cream during regular picking of childhood cancer patients as a randomized controlled trial. Starting with this tragedy, like children with cancer are suffering because of many aspects, but especially this pricking, maybe it's not considered, but I would say that they are suffering a lot because they have at least one time of pricking per week. And it's for different reasons, like for treatment, for laboratory diagnosis, and it can cause pain, fear, and distress in these children, and sometimes non-compliance even with the treatment. Unfortunately, till now, we have limited solutions or like not enough for this problem that, for example, the analgesic creams take time to give or to relieve the pain. And for the technologies like virtual reality or iPads, we have limited resources till now. But I would say that virtual reality glasses are novel, immersive technologies with the capacity to distract the patients and the brain from or away of thinking about the pain, which is the theory of the distraction. So we aim to define the most effective distracting technique to reduce pain and anxiety of children with cancer during these prickings. So what is the most effective technique in this regard with our population, pediatric cancer, or children with cancer between 8 to 18 years, and we compared the tablets as non-immersive technique to the virtual reality as an immersive one, to the standard of care in our clinic, which is the lidocaine and pyrrolocaine local creams. And we our outcomes, pain by VAS scale and anxiety by MASC-10 short version scale validated into Hungarian, and satisfaction by using 4 Likert scale. We hypothesized that the use of virtual reality is the most effective to reduce pain and anxiety in children with cancer during these prickings. We are looking for the implication of the results we will get on different levels with statisticians, with clinicians, and also policymakers. All in all, our goal is to minimize the suffering of the cancer patients by recruiting the new technology in this regard, and we are looking for more results and also participating with our results in ESMO conference and Global Health Conference soon. Thank you so much for your listening. Somewhere, something incredible is waiting to be known.
Very interesting topic. To tell the truth, I really don't know what is digital health. Can you categorize? Because normally we use these sentences that is not good, internet using, all the kids use too much tablets, too much mobile phone, too much internet, website, and so on. And this is not good for intelligence, not good for social effects, not good for mental improvement, and not good for everything, normally or generally. So what does it mean here, this digital health? How can it be healthy? What do you think?
Okay. Thank you so much for your question. And actually, I would like to have more time to talk about these technologies, because actually there are a lot of details regarding them. But the point, like, we are recruiting the technology in healthcare, which is that the intervention is designed for this purpose. I mean, like, the websites are for interaction with the patients and giving them resources. And I would say that the mobile application is very similar to the web platform, but with the advantage of like easily access to the mobile application, having it everywhere, also contacting with the medical staff, like I would say alarming them about the vital signs and the results of the patients. So the point that we can recruit the technology the way we want in healthcare and to make it like effective some way, especially that let's say on the clinician, from a clinician also point of view, like instead of getting wrong information that can terrify especially the cancer patients, like asking ChatGPT, for example, so they can get like good resources, the ones that we can trust. On the other side, talking about games and virtual reality, especially with like children and teenagers, it's also designed in a way to make it effective and like not I would say dangerous for them, because for the games it's also timed how to use it, even it's an exer game or even like an educational game, so they can use it in specific timings and specific sessions under supervision. Plus, because of their fatigue, they can't like exercise in exer gamings, which is game and exercise together, like healthy children or healthy people. So also it's under supervision according to their ability. The virtual reality is also can be for educational purposes, not just like distraction, or I mean like the pleasant distraction of the reality. Also, it can be for learning. I think even the doctors nowadays are using it for like learning in surgery. And we can use it for learning about radiotherapy, because I guess it's a very terrifying stage in the cancer treatment.
Do you think this virtual reality is better than the real reality? So it's not better to discuss with the children, to play with them, to play cards, to make familiar activities, to make sports or something like that? Is it not healthy or not better than this digital something?
Like talking especially about virtual reality.
Yeah, I know, but
I would say like maybe like seeing things can convince people much more. That's what is the concept. Like, for example, telling the patient about getting into the room and getting the radiotherapy. Like in theory, it's okay, but for them it's very terrifying. But by the virtual immersive reality, they can see exactly what's gonna happen, like I would say simulation of what's going to happen during the procedure, which can make the anxiety less and even like educate better. Regarding the children, I think like during the needle procedure, nothing can like calm them down. Sometimes using like the keys was, or like, you know, especially that they shouldn't move. So using the headset and the immersive environment can like let them enjoying and like maybe playing games by just moving the head. So well, let's say that also the RCT can tell more.
No, this is the current situation and this is the future, but I don't know this is the good way, but it's my personal opinion also.
Thank you so much for your note.
Thank you for your study, because it's very modern, but I don't know really what this digital health means.
Okay, I think the effect of virtual reality depends on the content. There was a study 15 years ago, so it's an old study, in atopic dermatitis, which is a chronic, inflammatory, very, very itching skin disease. And this study showed that that patient, when they game with this special video games, these patients showed more itchy skin, and their skin symptoms worsen because of these terrible games. What do you think about it?
Okay. Thank you for your question. Actually, you're right that this virtual reality is not just for like cancer, it's also for burned patients and different chronic situations. But talking especially like about cancer as a model for others, the design of the intervention should align with the situation. And the virtual reality is not all the time just playing. It can be just watching movies like you're walking in a forest, jungle, ocean, and whatever. But I would like to mention something interesting I noticed in one of the articles, that to choose the content of the virtual reality, they got like a jury, or like I would say expert discussion related to the physicians and also psychiatric opinions. So the result was a bit surprising for me, because roller coaster was the best to distract the mind from the pain or thinking or an anxiety. So I would say that it depends on the situation itself. And in case of like chronic disease, I think also maybe the medication should align with this as well. Like, I'm not expert in this field, but I would say that it's the challenge of the virtual reality. It can distract the mind, but the distraction depends first of all on the content, honestly.
Any questions from the audience?
So congratulations. Question about artificial intelligence. You are close, let's say, to the topic. Are there papers? It was not the aim of our study, but are there papers for anxiety or for situations like this where it can be, I don't know, used to help the patient, maybe become a personalized, agent for the patient whom they can use, and they can provide a lot of feedback and help and support. Is there any data about it? Maybe you encountered it. Do you have any knowledge on that you can share?
Thank you for your question. Actually, for the AI, it can be like, I think, recruited in the mobile applications or in the platforms as an idea. But regarding especially the cancer patients and the data I've checked, it was more like communicating with the medical staff, and like nurses can like navigate or even control some of the mobile applications, getting the PRO, which is the patient-reported outcomes through this. It can be also kind of like the solution for the long distance, like telehealth. But honestly, like using the AI itself in this regard was not detected by my study.